Good afternoon, everyone. Welcome. Today is Wednesday, November 6th, 2024. We are gathered for a work session from Human and Economic Health Service Area. My name is John Kafalis, Commissioner from District 1, Chair of the Board of County Commissioners, joined by my colleagues, Kristen Stevens and Jody Shattuck McNally. Across the way, we have our County Manager, Lorenda Volker, and I think at this time I'll turn it over to Laura.
Thank you, Commissioner. I am Laura Walker, and I serve as the Human and Economic Health Service Area Director for the county. And this is one of our regularly scheduled quarterly work sessions. So I'm grateful to have some time to come and share with the board, really spotlighting good things that are happening in the Human and Economic Health Services area. Sometimes we talk about partnerships, sometimes we talk about programs that have significantly beneficial outcomes for our community. And this time I'm turning it a little bit inward to talk about some of the really good work that our Human Services Department has been doing with engaging with their staff and having staff support one another. As the board knows, Human Services has some of the most heart-wrenching work, I believe, that this county performs for this community, and some very difficult circumstances that they see with the people that they serve. And so it's a high-stress job. And so taking care of that staff is beneficial not only for the services that they end up delivering to the community, but also keeping people engaged with the work and better retention, because we know that turnover is expensive no matter what industry you're talking about. So today is actually Heather O'Hare's birthday. She is our Human Services Director, but she is taking the day off to celebrate her birthday, which I think is a very well-deserved event for her to take some time for herself. So we have Lori Metz, who's our, well, I'll let them introduce themselves with their proper titles, but we have Lori Metz and Vanessa Fuel from the Human Services Executive Team to present about the programs that they've been using to help staff do better and feel better in that department. So I'll turn it over to them.
Thank you, Laura. I'm Lori Metz. I'm the Division Manager for Aging and Adult Services for Human Services.
And I'm Vanessa Fuel, Division Manager for Benefits and Community Support Division.
So Vanessa and I are here today to chat with you about some initiatives that are happening in Human Services, particularly around our use of the Science of Hope. Some of this information you all have heard before, and opportunities that we've had to have to share with you all our initiatives and what we're doing to support staff. So I would invite you all to make this more conversational with us. Please ask questions throughout as we go, and we'll get through the information together. We also will be presenting on quite a bit of HOPE information at our next Board of Social Services with you all next month. So we're not going to go super deep. So this is the team, this is us, as you all know here. Okay.
So as you might recall, in 2020, we updated our vision, mission, and incorporated a staff statement. The purpose of that update as it relates to our mission statement was really to encompass all of our service areas that also included the prevention work that we have, and thinking about how we're expanding as a department. But we really thought it was intentional to highlight our staff in our strategic planning process as it related to updating our vision and mission statement. Our staff, as Laura mentioned, thank you for teeing that up, Laura, that the work of the Department of the Human Services is difficult work. No matter what job you have in the department, it's a hard job. You might be seeing sensitive information, dealing with sensitive information, working with people and their struggles. I wanted to also thank you all for attending our poverty simulation yesterday. That was an impactful, immersive experience that really helped us as a collective department think differently about how we partner with people experiencing poverty. So our staff statement really is to say this work doesn't get done without the people who show up and do it every day. And we want to make sure that we're taking care of the people who do the difficult work. If we as a department are taking care of the people who do the work, they're going to take care of the people that they serve. And also wanted to give a shout out to the commissioners. Thank you for your investment in Nectar. This is something we regularly hear from our staff, that they appreciate being able to have acknowledgement in other ways through Nectar. People love it. So thank you for that.
Okay, so Lori Metz again with Human Services Aging and Adult. So here is a little bit of a snapshot about the Science of Hope through the University of Oklahoma. Dr. Chad Hillman and Angela Ferris through Oklahoma are the ones who are championing this work. And in the simplest of phrasing, hope is the belief that tomorrow will be better than today. And that is based on a few main ideas about creating and setting desirable goals, having pathways to attain those goals, and then agency or willpower to pursue them. And so this has become something that we are trying to integrate in several different levels in the department, and we'll get into those a little bit further. But we have included links in your handouts and in today's presentation to learn a little bit more about what they're doing there. So there's over 2,000 published research studies on hope through the University of Oklahoma. It is one of the biggest predictors of well-being across the lifespan. In human services, there's a lot of discussion about resiliency. It is the belief of the Science of Hope that resiliency is a portion of hope. It's part of hope, that hope is a larger collective when it comes to those skills. So what the Research Center is trying to bring to light is to increase hope, to find out what hope robbers are, that there are things in our lives that can rob hope from us, and increasing our ability to intentionally nurture and rebuild the hope. This link here is a TED Talk that's quite fabulous, done by Chan Hellman, where he talks a lot about his personal experiences as being homeless and as a young youth, and how it brought him to this place of hope. He and Dr. Ferris are quite a team together when they present, because he's a research scientist and she's a social work professor. So it's a great kind of the way they play off of one another, and he can bring in the science and she brings in the real world experience. A large part of the Science of Hope is around adverse childhood experiences, which is the ACEs scores. So those adverse childhood experiences are abuse and neglect, witnessing violence in the home or community, substance abuse diagnosis, living in poverty, incarceration, parental separation and divorce, discrimination, and unstable housing or homelessness. So adults who have experienced trauma in their lives have typically also had these adverse childhood experiences. And how that comes out is these things that are listed on the screen here. Their inability to trust one another, expectation of betrayal, guarded or anxious. And I think this might feel obvious when we talk about the clients or the community that we serve in human services, but it's a bit of a shift when we start thinking about it from a staff lens, that we are having staff coming in with these experiences, and then when information is shared, whether it be just a simple change in policy or procedure, or maybe a troubling incident at work, that this is how they are reacting to it because of what they're bringing into the work. And so trauma that would come out of these adverse childhood experiences is labeled as a hope robber. So that is something that does not allow people to rebuild that hope in their life once they have felt that it has gone away and that they don't have control over tomorrow being better than today. I would say that in working with Dr. Ferris, that has been a very impactful piece for our staff, is that this is something that is yours to have, and that we collectively will have hope as an agency as well. I think that resiliency can feel that the responsibility is on you, largely to be resilient and to provide that resiliency for your clients. But in hope, there's collective hope too in the agency. So because of this, we've been very intentional of integrating hope into different levels of the department, like I said. One of the most significant places is through our peer program. So peer is an acronym, of course, Partnership for Employee Engagement and Retention. As you all know, we launched this in the spring of 2020, shortly after a small global pandemic happened. So launching it virtually was an interesting challenge, but I think we've come a long way with it. Staff still own this piece. We have a group of people who continue to be dedicated to pursuing different changes in this program to meet the needs of our clients through our staff. So the way we've integrated HOPE intentionally is from the very beginning. So through our onboarding process, it is introduced to staff on their very first day when they meet their navigator. All of our staff navigators are also HOPE navigators, trained by Dr. Ferris and Dr. Wellman out of Oklahoma. So they're using HOPE-centered language. We're making sure the materials that we're sharing with them are from that lens as well. And then during their official onboarding presentation with the executive leadership team and other individuals from the department, they actually watch the TED Talk, so it's from the beginning. So through our peer ambassador program, which is the one-to-one peer support program that we have at the department, those ambassadors have had the opportunity to meet with Dr. Ferris individually several times throughout this year to just get ideas when it comes to meeting with people and bringing that HOPE language. And also the ambassadors are doing a lot more of group sessions as well. We have found that those are much more successful than the one-to-one, that the staff in our area respond to that in a very enthusiastic way. So they have actually built out an entire curriculum for us for 2025 through the University of Oklahoma. So that's awesome to be able to have them with us. The other piece where we're doing it is through the resilience groups. So Resilience Alliance is a curriculum out of NYU that was targeted towards child welfare workers. That is a set curriculum about building resiliency within a group of staff who are doing this challenging work. So we had that group going for the last 10 years in our child welfare division and did expand it in January of this year to be department-wide. So now we have several groups throughout the department that is going through this particular curriculum, and for the first time ever, we have a Resilience Alliance group that is only for supervisors. It is our fullest and most well-attended. So I think that we know that there might be more of those in our future. So the staff that are leading those groups are also meeting with Dr. Ferris on a regular basis to figure out how we can kind of merge those curriculums together and not lose the integrity of the work that the Resilience Alliance curriculum has shown to be successful over and over again, but using the HOPE initiative as well. Okay.
So in working with the University of Oklahoma, as Lori mentioned, we are working to infuse the Science of Hope into our peer program. But then last year for our all staff meeting, we had the Science of Hope presentation for all staff. So part of this was to build common language and common understanding. So people know what we're working on. What is it that we're doing together? What does hope mean? And what does it look like in action? Hope is not a policy decision. It is behavioral. So how we then define that and how it shows up, and also how we will measure our hope. So Lori provided you all with a hope scale. Did everybody get that? Great. So this is the hope scale. At that all staff meeting in 2023, we had our entire human services department complete the hope scale. That gave us some baseline data about where are we right now. You may see here that there is an outlier that had a 0. That person was actually our highest hope person. They just flipped the scale. So we were very worried about this individual, and were able to find out who it was and make sure that we clarified that they are actually the highest hope person that we have in the department. We're also implementing the Science of Hope in supervision, and as Lori mentioned, having that supervisory group that's meeting and receiving support from one another, being able to talk about the difficult nature of supervising staff who do difficult work. How do you support them in their professional development? And how do you as a supervisor become a pathway for professional development for your staff? And then, so our plan here is we reassessed our entire department, and we'll show you that at the end. But just wanted to give you a sense for how are we measuring hope. We're using the hope scale and making sure that we're measuring at a somewhat regular cadence so that we can see if the work that we're doing is making an impact.
Okay. So, in addition to integrating Hope into the peer program, which kind of feels natural, right? Like that's a place it should be. That's where the support is. That's where we're trying to build that level of rebuilding hope and identifying those hope robbers through those trauma experiences. Each division has also identified additional hope projects that they'll be working on throughout our time. And again, you'll be seeing some of these highlighted in the coming months with our strategic plan that's about to launch. So the Administration Communication Excellence Division is going to be largely working on a lot of the communication that we have, both externally and internally, making sure that the language has been reviewed and it's coming from a hope lens. The University of Oklahoma has actually sent us templates of the letters that get sent out to different public benefit recipients that have all been redone to be from a hope-centered lens. So that's pretty exciting to be able to have that impact on that larger level. There's a lot of communication that comes out from our benefits department to our recipients. So that's a pretty large reach to do from the beginning. We also recently just did another iteration of the Answers on Aging guide through the Office on Aging, and the hope language was used to be able to frame that information.
Can you give us like an example of what hope-centered language, because I really love this idea, right? I mean, because when you're giving kind of difficult information, I mean, like, I feel like and I'm glad to have all these resources to be able to look back at, but it seems like it's a really good idea, right? I mean, even when you're delivering something that's very difficult, it's good to be able to deliver that in a way that is positive. And I think if we did that more, just across the board, we would all be better. But can you just give us an example
Absolutely.
of what that might look like?
I'd be happy to. Thank you, Commissioner Stevens. So I think there's two different versions. So in talking to a staff person about maybe what their goals are for the upcoming year and allowing them to share with you what that attainable goal is, then our role as leadership is to help identify the multiple pathways to help them get there. And support them through those pathways. And then as they're working through those goals, if they start to lose agency or willpower, helping them find why. Why are we starting to lose steam on this? What are we doing differently? And then also trying to find those multiple pathways, that there's more than one way to this solution. And I feel like in our work, to clients in particular, that it feels like we only have one road, when actually there's several. So when we communicate to them saying, we do need this is the end goal, is to receive SNAP benefits, but then here's the multiple ways, the pathways that we can assist you with getting there. But I think just being very cognizant when they start to feel agency or willpower start to deplete, or when one of those pathways gets blocked. And so using that kind of language.
Yeah, that's great that you can use that both externally and internally, and then I think you're right. Then people kind of start to think in that way, right? And it changes that whole, outlook of how we can actually get this work done. Okay, cool. Thank you. Thanks.
If I could just add something too, I think even just looking at the way that these questions are worded on the HOPE scale, to me, I've seen many of these kinds of assessments, both for the clientele that the Human Services Department serves, but also for how you handle staff. And so many of the surveying things are worded in a negative context. And then you're responding to how little the difficulty is rather than how hopeful you are about your capability to overcome something, even if a challenge is before you. So I think even looking at this, it's a very different kind of a survey than I'm used to seeing for either the external or the internal population.
Another piece that I would add is that Dr. Ferris consistently says when she's meeting with us that hope without a plan is just a wish. So, having people understand that, your goals aren't attainable, we just have to find the pathway to get there and what that looks like. And that there could be multiple pathways to get there. So she's very positive. And because she's a college professor, she's an amazing presenter. And and she doesn't mind coming here in person because her daughter goes to CSU. So, so continuing on with aging and adult services, we are working about sharing hope stories across our teams. We just had our division meeting for the fall just last month, and we gathered a bunch of the hope stories that staff have been sharing in their individual team meetings. And Vanessa will get into much more detail about the bang-up job they're doing in benefits with this. And we had a slideshow going throughout our division meeting sharing those stories for people to understand and see. For children, youth, and family, they're also adopting hope as that common shared language among staff, but they actually have a separate goal as well where they're integrating it into their foster parent training and recruitment. So that's an exciting piece. And with operations, they're trying to bring together the staff on the overall vision of what operations is. Operations, their client and customer is largely internal. So just trying to make those connections for their teams. So, and I'm going to pass this over to, we went out of order, alphabetical order, to leave benefits and community support for last, because Vanessa's going to share with us the amazing work that benefits is doing and that we've all been able to ride the coattails of during these last few months.
Thanks, Lori. So in benefits and community support, you kind of teed it up for me, Laura. Thanks for that. We often will look at the employee survey that comes out, right? Everybody takes the employee survey, we do a deep dive into that, and we hear some pretty consistent themes. People say we feel like decisions are made without us or without our consideration. We find out about them later. We wish we had more engagement and involvement. We want to know more about what leadership is up to and like, what are you guys doing? And what are you talking about? Who was there when decisions were made? So we really took a shadow board kind of model with our PATH committee, which of course is an acronym, Peer Advisors Toward Hope. Didn't write that one out. But pathways to use that hope language, that we wanted a group of staff to come together to help us assess our organizational culture within our division and help us figure out how to improve that. And one of the places that we really wanted to start was it's all line level staff from representing every business unit across the division. So there's 10 staff that participate with myself and the 3 deputy division managers within the Benefits and Community Support Division. When we were putting this work together, we did a visioning session, tried to figure out really what is the impact we're trying to have with this. Like, let's not just have another group of people meeting for the sake of meeting. We want this to be meaningful time if we're going to spend the time together each month and beyond. So go back, sorry. Our goal was our long-term operating under the assumption that engaged employees offer better customer service. So the more engaged we can have, the more supported our employees feel, the more support they can offer to our customers. We looked at some of our survey data so that we could be really targeted in what we were thinking about addressing, involving staff in those decisions, making sure that leadership has awareness. Sometimes the decision's made and you don't always hear right away, how did that land? How did that go? Oh, there was a pain point somewhere that was unanticipated with that decision. It's an opportunity for a feedback loop. It's also an opportunity for us to build trust because sometimes I don't get the face time with every line staff person. There's 160 some staff in BCS, so I don't get to see them all the time, and certainly don't get to have that face time. So increasing that opportunity to say, hey, come talk to me, like let's just have a conversation. And then this is also a professional development space for the staff. Being on a committee, what is my responsibility on a committee? How do I go back and serve as a liaison to my team? And how do I bring that information back to this group? Some of the folks that we have that participate have never been on a committee before. So making sure that we have training and helping them understand this is what that looks like when you join a committee. So when we got together with our group of staff, we asked the managers to nominate two staff from each of their teams, and they had to write how this person is a problem-solving person. How do they already come to the table with a hope mindset? They're a person that's looking for pathways, right? They might say, I'm interested in making this change. Here's some things I'm already thinking about that we could do to implement that. And we realized that so much of organizational culture is developed in the stories that we tell each other. So we started with storytelling. How do we tell that story of that difficult client that we just got off the phone with? And how does that leave me feeling? When I go and talk to my coworker, does my coworker offer me hope? Or do they rob hope in that conversation? Are they just back to, oh, they made that decision again, now we have to do the next thing? Or is it a person that's going to reframe that to say, hey, you had that hard call and you had to tell that person that they weren't eligible for food assistance, but you offered them a lot of resources and maybe something that they didn't have otherwise. So reframing from the negative impact that that interaction could have had to how are you the pathway? And if you don't have the hope yourself, you can borrow mine. That's one of the key principles, is that hope begets hope. So if we could have people planted across our organization to be the hope sharers, those that will lend their hope to others, maybe this will start to shift the way that people are thinking about not only the customers they serve, but the organization that they work for. Sometimes you'll see folks who are like, I have the empathy all day for the people that I serve. But then when I start to think about the work part, the organization part, it's easy for me to get into negative thinking. So this is really designed to help say, hey, I'm in that meeting and Vanessa and the deputy division managers talked to us about how that decision was made. Let me tell you more about that. Or they asked us and we gave input. Sometimes there's difficult choices on the table and you have to make a difficult call one way or the other. But having people who have a little bit of understanding about how decisions are made, again, planted around the organization, it was our assumption that this would help everyone collectively. So we asked them to go into their team meetings and to share stories of hope. So we designed a hope framework collectively with the committee, and this is what Lori's team borrowed from us, which was kind of cool to like see it take off. It was something that in BCS we were thinking about. We've got case managers, we've got community support specialists, we've got folks that are helping with child support. So the job functions are different, and we were thinking about how can we make this applicable to everyone instead of focusing programmatically, right? How are we focusing as an organizational development lens? So the storytelling felt like a good option because you could implement your story, you could tell your story and apply your story to the framework, but everybody's using the same framework. So they got to choose if they wanted to share a personal story or if they wanted to share a work-related story. They had to identify what was the situation. They talked about what the pathways were, what the goal was, how their willpower may or may not have depleted in that amount of time. Some of our interactions with clients are brief, and others are in child support. They could have a family for 18 or 20 years. So, right, depending on what your interactions may be, it could look different from one team to the next. So we asked all of our PATH committee members to bravely go out into their teams and share their stories of hope, and then come back and tell us how it went. And by and large, everyone said it was a good experience. But then maybe we have some ideas for refinement. So we refined the framework a little bit, and then each person asked a person on their team to be the next person to tell the story. The idea here is if I have to think about a story that I'm going to share with my team, I'm going to start looking for hope. I'm going to look for my behavior that is hopeful behavior. That's different than looking for it in someone else. What is it that I do? How am I serving as a pathway, or how am I achieving my own goals and finding my own pathways? And then recognizing in myself, I am the hope champion. So now we're giving it to the next person and asking them to be looking for hope from their own behavior. So each time, a new person would tell a story, and then that person would ask another person to tell the story. So it's been kind of cascading month over month of everyone getting an opportunity to share a story of hope. And it's been pretty cool. So we had one person on our committee who said, "This has changed my life. It's changed the way I think about my family. It's changed the way I think about my work. It's changed the way I think about my kids. It's changed my life." Sorry, I'm gonna lose it. I knew it. It's powerful and important. We had another person on our committee who said, for me, I would know that this is working when I come in and people look up and say hello, say good morning, stop and chat in the break room. Hang on, I'll get there, because this was super cool. She came back the next month and she said, "Oh, I put together a walking group and I put together a lunch club." She's like, "I'm the hope." We were like, yes, it's not a policy decision. Yeah. It's behavior. It's how we show up together and how we support each other, even when it can feel like it's a tough moment. Yeah. Just leave that there. No, I'm good, thanks. So it's been pretty cool to see staff showing up in this way, in a different way with each other, because then it's also then showing up in how they're working with their customers. Almost everybody has a customer story, right, of what a glimmer of hope that they could find in that interaction. But then to really say that it's me and it's my work and it's how I show up every day, that's a shift in just what you're looking for and how you're finding it in your day-to-day. And it can go beyond just our organizational culture and into your family life, right? So we also have a fun committee in the Benefits and Community Support Division. I think we all have a fun committee, yeah. Anyway, each of us has a fun committee. But our fun committee said that they wanted to do a positivity board in September. So they found places in each of our locations to just have sticky pads there and put something that you're feeling positive about. Just look for good things. And people filled them up. It was, and it was for everybody to use, right? Because it was in each of our locations. So anybody could come and write something on a positivity board, and each location then, when I would go week after week to a different place and see those boards filled up with the things that people are finding that they can feel positive about, was really powerful. And now for November, we're doing a thankful board. So just trying to plant these nudges around our physical space to help keep that top of mind, again, even when there might be a tough moment that we're facing. I think that's everything on this. So, as I mentioned earlier, in 2023, we surveyed our entire department to get our baseline data about our HOPE scores. In 2024, in September, right, we surveyed everyone again, and nearly across the board, I feel like our ACE team is not quite fair because there's so few people that there's, just one person going down a little bit. But overall, we collectively went up. In some cases in BCS, it was almost 2 points, I think. Yep. But then in Aging and Adult Services by 5 points. So this is the data that we're looking at to see, is it working? So it's not just a feeling. We really are trying to measure, is it as impactful as I think it is? Just because I think it's impactful doesn't mean it is for everybody. So we're finding that it's working.
And Vanessa, I would also add, even though the ACE division went down, they're still second highest out of the five.
I mean, they were already
that's another piece of context to just look when you're looking at these kind of numbers.
Yeah. So that's the end of our formal presentation. What questions or discussion items do you have?
Thank you. Thank you, colleagues. Commissioner, please.
Thank you. First, thank you very much for bringing this, and obviously you're very invested in it, and that means that makes a world of difference. So my first question is, are you all included in this numbers? Okay, so, and then are you kind of pulled out separately? Because I'm assuming that when all your staff are feeling this vibe, it must make your jobs measurably better. I'm curious about that. How does your leadership team, how has it changed your hope levels?
Yeah, we are definitely collectively invested and find a lot of value in the work. But I don't know that we've ever pulled the leadership team out separately to look at our data. That would be kind of an interesting turn of the prism to see if our hope score changed as a leadership team at all.
Yeah, I just think, it's important for, people who are kind of taking a lot of the, kind of that responsibility, just how it helps you as well, and if that cascades, up and things. I'm just curious about that. And then I guess my other question is, this is great for staff. Do you have something correlating or maybe happening at the same time as you're seeing maybe how clients are leaving feeling more hopeful? Is there any kind of data being taken there? So is this, I don't know if you're doing surveys with people after an interaction, if this is kind of cascading into their experiences and what they're leaving with too. I'm just curious.
Thank you for your question, Commissioner. We have not gone to that step yet. We decided to start internally first. But yeah, that's definitely in the plan, is to see what the impact is after that interaction with us. Absolutely.
Well, just really, what a great message and work session to have this morning. And just, and I'm looking forward. I think, oh, cool, I can go watch this TED Talk tonight. So I appreciate all these links and these ideas. And lastly, just any ideas that you have for sharing with other department heads or department leads for their, even in our office, like this thankful thing is kind of a cool idea. I just wonder what else we can learn from this to help, across the whole Larimer County staff, how we can kind of use some of this to help folks feel. And so I'm just curious about that. And so, but thank you. This has really been impactful for me today. Thank you.
I will respond to the one comment there about sharing with other departments. Heather has been bringing this information and status checks to the other human and economic health directors. We meet once a month, and she's been providing this to us. And it was interesting because on the 5th floor, because that's where my office is, but when I walk through the economic and workforce development cubicle area, they have a thankful tree right now that's posted up on the side of one of the cubicles, and they have little leaves that you can write things that you appreciate about your coworkers, and we're building a tree on that floor too. So these ideas can cut across. I do think it's a matter of finding the right places and the right groups of people to go share this with. But I know that Heather and her team would be happy, like, to come to another service area's monthly meeting and share some of the good things that are happening. I do know that some of the foundations for this peer program actually came out of the sheriff's office and their peer support program in the early days when we were first researching this notion of starting a peer program, because that was the one really sad thing about moving into this position in January of 2020, because that group was just about to launch on this work that we've been doing for a year to get ready for the launch of this peer program. So I'm really proud to see how well it's turned out and how useful it is to folks.
Thank you. That's really helpful.
Thank you, Commissioner. Commissioner Stevens, questions or comments, please?
Yeah, wow. First of all, I got goosebumps, then I got teary with you, Vanessa. This is really impactful work. This is, we're all in the business of hope in a way. We're in local government. We believe that we can do things that help people and enrich their lives. That's why we do this work. We're not necessarily all that well paid for it. We're not necessarily, but we do it because we feel like it does change lives for the better, right? And so, but it is hard, and so, as you said, and so I just think that finding a way to really make that, it does change people's lives when you can create that sort of mindset of, that hopefulness instead of that sort of scarcity kind of, tense kind of environment. I mean, I don't know, what's the saying, culture eats strategy for breakfast, right? And that's what you're creating, a culture, right? I mean, it doesn't mean you can't create a strategy alongside of it, But if you don't have that in place, you can't do the work well. And so wow, yeah, I'm blown away. I want to learn more about this because I think we can all incorporate this into our work and our lives and do better. And so I'm so glad. And, I'll just say spending time with all the folks yesterday in the poverty simulation, I mean, I have that sense. I sat at breakfast with people, and then I was, in a family group with some of your staff, and did the breakdown at the end of, how that went. And the whole experience was just really, I can tell that people feel good about the work that they're doing. I can tell that they feel hopeful. I can tell this is working because it is a group that was there. There weren't a lot of people that were saying anything negative. Everybody was, how do we do our work better? How do we understand our clients better? How do we treat each other? And so you're transforming lives, not just in the community, but also within your group. And that's just, yeah. I mean, I can't say enough about it. I think it's wonderful. Thank you.
Thank you, Commissioner. I have two questions and perhaps a couple of comments that might be build on what my colleagues have said. My first question is, are we still using SIGB? And if so, how does that align with this HOPE work or complement this HOPE work? And maybe you could remind us a little bit of what SIGB is.
Sure. Thank you, Commissioner. So SIGB was an app that was utilized by the Department of Human Services to ask daily check-in questions across the staff at every level. The contract with SIGB did expire in the spring, and we chose to part ways from them as we started to integrate this other feeling of hope and the science of hope into the work.
Thank you.
Of course.
My second question, it kind of builds on what I think I heard from Commissioner Shattuck McNally, and that is the applicability of this work throughout the county organization. And I am reminded, and I forgot to talk about this with Lorendo when we had our little check-in, but the Economic and Workforce Development folks, they had Rich Feller come to the September Work Symposium, and I have the slides. I mean, there was a great presentation, and he talked about champions in the workplace, and they use a scale, and it seems like it would complement this. So I wanted to bring that to your attention because I think, I think my follow-up with Lorinda, which I forgot to do, was to see, because Mark Johnston had talked about, and maybe you know more about this, Laura, but Mark had talked about bringing Rich or that information within the Economic and Workforce Development Department. And then I wondered, HR, other departments. So I wonder if anybody wants to comment on that, but I think it's also very helpful, and it aligns with how do we support people to be hopeful, how do we support people to be champions in the workplace. You have any thoughts, Laura Walker?
I do, and thank you for the reminder. I will be following up with Mark to see if we could even have, I don't know if it's Dr. Feller or Mr. Feller, come to one of my monthly HEH directors meetings and have that be kind of a proving ground to see the applicability of the things that he has to offer to what's already happening in departments, especially in human services, where they've really advanced this program and made it very formalized and have a good framework to it, and they're consistent about it. But then offering to potentially bring that to Lorenda and Lori Kadrich, our assistant county manager, for an offering for maybe a department head meeting or some other management level of exposure outside of my service area, but our plan was to start within, and so that we could really see the applicability across different kinds of program areas within the county.
Thank you. That would be great. And I'm sure Mark, if you haven't already seen them, the slide presentation and some of the materials that were used during the Workforce Symposium, the scale, and there's actually an interesting self-survey that I thought was useful. I have some hard copies, and I do have an email that Amanda sent to me but I imagine you already have that or can access that,
Yes, I do.
of
Thank you.
course. Then my comments that you've all been anxiously awaiting, and then Miranda might have some wisdom. I just, a couple of things. Many, many, many years ago, I used to participate in something called reevaluation co-counseling. You might try Googling that, perhaps. Reevaluation co-counseling. And one of the premises of that was, I think, aligns well with what you've just shared. And it's prompting me to remember that when I meet with Lorinda or anybody, I used to, but we've gotten out of the habit. I would always begin the meeting or the conversation, what's new and good? Can you share something that's new and good? Because it's really human nature is to focus on what's old and not so good. And so I wonder if that's a tool that you're aware of, and maybe we could remember to ask that of each other before we have our little meetings. And the final thought I have, when you mentioned about the new and good thing is a cool thing. And actually, sometimes people have a hard time thinking about that because they're not expecting that kind of question. And then I said, "Oh, that's okay. Just make it up. Just make it up." Anyway, the final comment is cross-reference and cross-pollination. When you mentioned about the thankful board or the thankful tree, somebody has a thankful tree. I'm reminded that Lori Hodges, who's on deck, last year or 2 years ago, she gave out what she called little gratitude jars, and they're really cool. They're bell jars, and the idea is you can put in a little slip of paper, daily or however often, of something you're grateful for. I wonder if everyone had a gratitude jar, perhaps on their desk. Maybe that might be a good thing. I believe that's all I have. Thank you for listening. Lorenda, do you have anything you'd like to, questions or comments, please?
I'm so impressed with the work that's being done because I remember, I'll take you back 10 years ago, we had turnover, we had stressed employees, we had stressed clients. We were looking for ways to provide support, and you all were researching as, far and wide the various things you could do. And so, this is a department that is not afraid to try something for the benefit of their staff. It's not a large investment of money. It's often an investment of time for leadership. And you involve staff, in the right ways to kind of get their feedback on this stuff. This wouldn't have worked then. Obviously, the iteration of efforts have come forward to really show honest and true care for staff so that that demonstrates that honest and true care for the community and the clients you serve. It flows out of the organization into the community, and don't we hope that clients take that hope home and they can be the hope when they get to their kitchen table and with their children and family. I know this will not stop at this, right? This will not be the end-all, be-all forever and ever. You will continue to look for new ways to do this. I just want to applaud the effort because you can't just sit back and say, well, it'll get better, right? It won't get better unless we make it better. And you all are that in action. So I know it's Heather's birthday. Happy birthday, Heather. But I think her leadership and her willingness to let these things happen and evolve and not want to control and manage is really, really important. It belongs to the staff. It gives them what they need. And when they need something different, you look for that too. So I just want to applaud you because we're leaps and bounds ahead of where we were. Pay is not necessarily why people stay, and I know we've addressed that as well. But it's this work environment, this culture, this feeling of being supported and that they make a difference. So I think that's really important.
Thank you, Lorinda. Colleagues, anything else that you'd like to share? Yes, Laura.
If I may, I neglected to say at the beginning when I was launching this topic is that Heather O'Hare, the Director of Human Services, was invited to come present at a national conference for her Public Human Services Association, which is a very well-attended conference. There are several thousand people go to this conference from across the country, and so she was invited to give a 75-minute presentation on this topic, and it was extremely well-received. So just wanted to acknowledge that this has gotten national attention as well in the human services space.
Great.
So, thank you.
And just one final additional comment. I might have mentioned to you folks that I'm charged with writing the commissioner's November column, and I've already discussed doing part two of something I did in the spring around building trust. And I think the timing of this presentation is very good, and I believe there'll be ideas, concepts that I can integrate from this conversation into the column. So that might be another way to perhaps multiply, folks thinking about this. Well, anything else, colleagues? You guys have anything else? Thank you very much for your hard work, and it was an interesting event yesterday, the poverty simulation, and I know we'll hear more about that in a couple of weeks when you all come back for Board of Social Services. So at 2:21, we are adjourned, and we wish you all a good day.